Right now for you at 5, as COVID cases keep rising, doctors say Omicron will likely become the dominant variant here in our state before the end of this month already. Channel 3 Eyewitness News reporter Mike Savino is following these details for us tonight. He's joining us live outside Hartford Hospital with more on how doctors are getting ready right now. Mike?
Well, Mark, if you look at the state's testing data, it will only show about 5% of our COVID cases are the Omicron variant. But doctors say that those numbers lag behind what's going on right now. They also say that Omicron can spread so much faster than Delta.
Some of the early indications are that in the next few days, it'll eventually become the majority of cases here in Connecticut.
Doctors say it's only a matter of time before the Omicron variant moves past Delta to become the dominant COVID strain. But you wouldn't know that based on the state's sequencing data, which found Omicron in just 5% of cases so far. But those numbers are often behind testing cases that already happened.
Certainly, I would think that it's higher than what we're seeing right now.
One reason doctors agree Omicron cases are growing is because of its high rate of transmissibility.
This is spreading 10 times faster. That's probably conservative.
Meanwhile, doctors are also trying to determine Omicron severity. Early indications are that it's more mild than Delta, but doctors note cases have predominantly been in young people who are better able to fend off COVID.
So I think there's too many variables at play to really make any definitive conclusions.
Doctors are curious what we'll see as Omicron spreads. A new study by the University of Hong Kong found that Omicron can replicate 70 times faster once it's in your body.
So if it's spreading 10 times faster, but it's only 30% less severe, you're still going to have a larger impact of Omicron.
So are public health officials changing their strategy because of Omicron?
We're still going to push vaccines. We're still going to push boosters. I think this makes masking even more important.
Meanwhile, the CDC has confirmed 54 people developed blood clots after getting the Johnson & Johnson vaccine.
So I think the overall recommendation is that the mRNA vaccines are preferred to the Johnson & Johnson vaccine.
Now, this rise in cases comes as many students are ending their fall semesters here at colleges and universities in Connecticut, but some schools are already taking steps to get ready for when those kids come back next month. I'll tell you what they're doing coming up on Eyewitness News at 6. For now, live from Hartford, Mike Savino, Channel 3 Eyewitness News.